to our YouTube channel. I'm Harmony.
And I am Favor.
Today we're going to be talking to you guys about the 4 main joint-related injuries.
We have strains,
Sprains,
dislocations,
and fractures. So let's get right into this video. Let's talk about muscle strains. Now, what is a muscle strain? Now, muscle strain occurs when the muscle is overstretched or torn. This occurs as a result of fatigue, overuse, or improper use of the joint. There are various symptoms that could help you or me indicate if the pain we're feeling after exercise is as a result of a muscle strain. You have pain, inability to move that affected area, stiffness, and soreness. There are various things that could also lead to a muscle strain. Have poor flexibility, poor conditioning, poor posture, and lack of proper warm-up before exercise. Now, for a muscle strain, if you realize, okay, I have a muscle strain, I can feel pain in this joint due to exercise that you have been involved in, you need ice. Ice to apply pressure on the affected area to enable reduction in pain, reduction in redness, or discoloration of skin. Then you need rest. Take a break from the rigorous activity to make sure that the affected area gets enough time to heal and come back to its proper position. Now, if after 1 week of pain or of all the symptoms that I have listed and you don't see any improvement even after trying ice and rest, please do consult a medical practitioner to ensure that a muscle strain or your symptoms don't go beyond what it is.
Next, sprains. A sprain is the stretching or tearing of the ligament. A ligament is a tough band of fibrous tissues that connect two bones together at a joint. The most common location for a sprain is at the ankle. Signs and symptoms vary depending on the severity of this injury and may include pain, swelling, bruising, and a limited ability to move at this affected joint. Causes: sprains can occur in the following circumstances: landing awkwardly from a jump, walking or exercising on an uneven surface, landing on an outstretched arm from a fall, and an overextension during a racket game like a tennis. When to see a doctor? Basically, mild sprains are treated at home. However, there are injuries that cause sprains and can also cause serious injuries such as fractures. So you should see a doctor if you notice that you can't bear weight or if you have pains at that affected joint, and if you have a numbness, like you can't feel anything in any of the affected area, you should see a doctor or a medical practitioner. Prevention. Regular stretching and strengthening exercises help in an overall physical conditioning of the body. Secondly, you should be in shape. Try to be in shape to engage in a sport, and you shouldn't engage in a sport to be in shape, as doing so can lead to an overextension or stretching.
Next, we have bone fractures. A bone fracture is a medical condition whereby the continuity of a bone is broken. However, this may also be as a result of other medical conditions that have been proven to weaken the strength of our bones. We have osteoporosis, some cancers, and brittle bone disease. Now, please note that fractures can occur at any part of the body. Now, we're going to go into the types of fractures that we have. There are several types of fractures, but I'm only going to be highlighting 3 main fractures in this video. You have the impacted fracture, the transverse fracture, and the oblique fracture. Now, an impacted fracture is basically where a fragment of bone goes into another fragment. You have the transverse fracture, which is a straight break across the bone, and an oblique fracture, which occurs diagonally to the long axis of a bone. Now, there are several symptoms that a patient can experience or experiences when they have fractures. You have pain, swelling, bruising, discoloration in the affected area, and a grating sensation. Now, grating sensations occur as a result of the broken bone. Continuous movement or stressing on that bone could cause a grating sensation. Now, there are also several things that can cause a fracture. You have things like a bad fall, an automobile accident, and underlying illnesses like I mentioned earlier. You have osteoporosis, some cancers, and brittle bone disease. Now, these diseases or medical conditions have been proven to weaken the strength of bones, which make people more prone to fractures. Then you have stress fractures. These are basically repeated stretches and strains. Now we're going to go into treatment that occurs or treatment that is recommended for fractures. Now first we have physical examination. Now please note that this is carried out by a medical practitioner in order to diagnose a patient, to know what is wrong or to identify the type of fracture that the patient is experiencing. Then we have the X-ray scans. You have the MRI or CT scans. These are not required all the time. It's only required in some cases, like some types of fractures. You have plastic surgery, which is required to help adjust the skin, damaged skin, or soft tissue. And finally, we have physical therapy, which is also needed in order to restore strength in muscles, restore strength in the affected area, which happens after healing has occurred.
Last but not the least, we have dislocations. Dislocations occur when the bones in the joint are separated or knocked out of their usual positions. Dislocations can be very painful and cause a general instability or immobility at the affected joint. Car accidents, falls, and contact sports such as football are the major causes of this injury. Signs and symptoms may vary depending on the severity of this injury and may include pains, swelling, discoloration, bruising, and a loss of movement ability at that affected joint. Treatment. If you've been diagnosed with dislocation, there are certain steps taken to help your healing process, and there are easy steps. First of all, try to get some rest. Don't repeat the action that caused your injury. Avoid it for a period of time. Secondly, ice and heat compress. Put it on your injury or the affected area. It helps the healing process. Thirdly, try taking pain relievers. It eases up the pains and everything. Last but not the least, maintain a range of motion around the affected area.
Thanks for watching this video. We hope it was as
informative,
resourceful,
and
educative as we wanted it to be to you. Please make sure you like, subscribe, and comment down below if you have experienced any of the joint-related injuries mentioned in our video. Thank you!